So we're back with those informations that are very, very important before doing bends. I have to say to you all the time that the first part of our course, it concerns to the anticipation of those errors that we commit during our treatment. So we are doing here the anticipation of the treatment, anticipation of the bends, because we are doing the treatment in a smooth way, meaning we are doing the treatment without the need of doing so much bends and so much loops in order to correct something that we incorporated in the treatment because of our mistakes. So we're here trying to anticipate. First part, we are just dealing with the positioning of the brackets and tubes in order to avoid bad position of those tooth or those teeth that we have as a result of our bad positioning during the first part of the treatment. So now we're going to talk about the height of the position of the bracket concerning to the height, concerning to the position, the incisor to the occlusal, through the incisor to the cervical part of the teeth, okay? So in this part of our course, we're going to deal with the height, the positioning of the bracket and the tube concerned to the height, okay? So we have to check all the time because we can do some errors, we can incorporate some errors in this part of the positioning. What I mean with this is that when we think about the centralization of the bracket and the position, the vertical position, we have to think about the center of the clinical crown. Why we think about the center of the clinical crown? Kleber, are you not going to use the positioning device to put the bracket? No, I just focus on the center of the crown because the majority of the brackets that I know, that I work with, they think about the positioning on the center of the crown because the bracket is the pre-adjusted bracket. I mean, the pre-adjusted bracket is the bracket that I use, probably you also use, because this is the most acceptable and most spread technique that we have nowadays. So we think about the center of the clinical crown because the bracket is designed to have that position to read the inclination, the angulation, and the ins and offsets that are incorporated, that are embedded inside those brackets because they are pre-adjusted. So they have inside them both angulation and inclination, and they have in addition the in and the out that are the thickness of the base of the bracket that are incorporated in order to have a compensation of the thickness of each tooth. So let me explain it better with images. I love images because of that, because sometimes we just try to explain something, but an image is worth a lot in this kind of situation in order to clarify all those thinkings. So this is what I think when I put the bracket in the center of the crown. So here we are centralizing the bracket with the center of the crown. The base, the center of the base, the center of the slot is positioned at the same height. We're just talking about height here, not angulation yet, but we're at the same height of the center of the crown, the clinical crown, which is this red dot here, and here we have the center of the slot of the bracket, okay? So why does it matter so much? Because the inclination, especially the inclination in this case, of each bracket, of each tooth, each bracket, because we are having here a pre-adjusted bracket, we are working with a pre-adjusted bracket. So in this case, they have the inclination of each tooth embedded in its structure, okay, in its base. For example, if we have something like 0 degrees of inclination of the crown, if you want that, we have this parallelism between this blue line and this red line, which is the base of the bracket, this wall of the bracket here of the slot, and the base of the bracket itself, okay? So if we have something different, for example, 3 degrees of inclination, or 7 degrees of inclination, or more than that, 12 degrees of inclination, what we have here is the difference between the inclination of the base of the bracket. Most of the brackets work this way because they have this differential inclination they may have inside the slot, not in the base of the bracket. Some brackets are like this, but they incorporate some errors also. In this case, we're thinking a bracket with the inclination embedded in its base, okay? Their base are 2 degrees, 1 degree, 3 degrees, whatever the company wanted to put inside, so they have it in the inclination of the base of this bracket. So we have here 3 degrees, and we have here 7 degrees, and more than that, 12 degrees. So as you can see, we didn't change the inclination of the slot of the bracket. We didn't change it. It's in the same position since the beginning. So what changes here is the inclination of the base, okay? So what is this? How is this related to our inclination of the teeth, or of our tooth or individual tooth? In this case, every time you choose a bracket, you choose a prescription of brackets, you have to understand what the prescription will give to you in order to position the inclination correctly of your crown, okay? So if you want, for example, a class 3 with a huge inclination to the upper incisors, you pick a different inclination, different prescription compared to a class 1. In a class 1 situation, we have, for example, 7 degrees. We're talking about the Andrews prescription, approximately 7 degrees of inclination. If you're using this bracket in a patient which has a class 3 situation, you need a more inclined upper teeth in order to compensate the position of the mandible and the maxilla, to compensate the malocclusion. So, for example, 12 degrees. So what if we change the inclination, change the prescription of the bracket? We'll change the inclination of the crown. Of course, we are just simplifying things here because we have many things to think in this situation. For example, the interrelation between the slot, the size of the slot and size of the bracket, the play between the slot and the wire, the slot and the wire. There is a play that we have to have in mind, that we need to have in mind in order to understand what is going to happen. We'll tackle this in another moment, but for now, what is important is to understand that we have different inclinations that are embedded, that are inside the slot, inside the base of the bracket, okay? That is built inside this base of the bracket. So 12 degrees, 3 degrees, 7 degrees, they will display different inclinations, because when we put our full size arch wire inside a slot, it will read the inclination that is embedded in its body, in its base. So we have here this 12 degrees. When we compare to other inclinations, to other prescriptions, we should have those different inclinations, both in crown and roots of those teeth, okay? So this is important because we are choosing the prescription that we want to correct the malocclusion that we are treating. So when you do this kind of reading of the inclination, we are trying to do a more smooth, a more linear treatment without the need of doing many torques or many bends to correct individually the position of those teeth, okay? We know that's not what we are going to do in our day-to-day practice, but this is how the thinking goes. This what was planned when the prescription is sold, when the prescription is, when we buy the prescription to put in our patient, okay? So we try to do less bends, we try to diminish, we try to lower our treatment time, our treatment with the patient in our chair. So we try to lower this time, lowering also the need for doing this kind of torques and bends and loops wherever it needs. So we're trying to save time here in our treatment, doing the right prescription, using the right prescription, using the right torque, using the right positioning of our brackets in order to save time in our treatment. So we don't need to do this kind of torque all the time, of bends all the time, because we did the correct positioning, we did the correct prescription, we chose the correct prescription for those patients. So let's move on. What if we change the height of the positioning of the bracket, for example? In a central incisor, for example, what will happen to our teeth, or our tooth in this case? So let's think about the center. This is what we have. So when the teeth is perfectly positioned in its perfect situation, let's say, we'll have a bracket centered in the crown and this vertical aspect. So it is centered here. The reading of the torque here will be exactly 0, because the inclination of the tooth, inclination of the crown, you know that Andrews, when did this 6 keys of a normal occlusion, he thought just about the crown, and he prescribed those brackets, those nice brackets in the center of those crowns in a class 1 situation, firstly. And here we have a class 1 case where the central incisor is perfectly inclined. We're saying about inclination, we're talking about inclination here. So we have the central incisor with the inclination of 7 degrees concerning to the horizontal line, 7 degrees here, so 7 degrees of inclination embedded in this bracket, in this pre-adjusted bracket. Okay, this is important because when you put here our arch wire, our rectangular arch wire, full size rectangular arch wire, it will read the inclination that is built in this bracket. And what if we change now this height? What if we change now the position, vertically speaking, the vertically positioning this bracket, for example, upwards? What is going to happen? Now, we don't know the interaction between the inclination of the arch wire, which is 0, I'm talking about the relationship, or we don't know what will be the real relationship between the inclination of the vertical, the inclination of the transversal section of the arch wire, the rectangular arch wire, and the inclination of the slot of the bracket, because we changed the inclination. Remember, the buccal face of the incisor is not flat. It has this curvature here, which will change the inclination of the slot when we change the position that we put in our bracket. So in this case, we will have not a passive relationship between the inclination of the slot and the inclination of the rectangular wire, the transversal section of the rectangular wire. So they have now an active relationship, not a passive relationship as it was before. So now we know what we are going to have now, because it's going to generate here a couple when we do this kind of positioning of the arch wire. So now I'm going to position the arch wire inside the slots of the posterior teeth and inside the tube of the molar. When we do this, we'll generate here a couple which will generate a palatal crown torque. So in this case, even though you didn't want the palatal crown torque, you're going to have it, because the relationship between the rectangular arch wire, a full-size rectangular arch wire and the inclination of the slot will generate a palatal crown torque. So this is important to have in mind because sometimes you do that. Can you pick a situation where you do this very often? For example, an open bite, an anterior open bite. In this case, we try to avoid the center of the positioning of the bracket and we go in an apical direction. We go in an apical direction, and when we do that, we will change the relationship between the rectangular wire, a neutral, meaning no torque in the rectangular arch wire, and the angulation, in this case, the inclination of the slot of the bracket. So this is what we see here. Let's move on, and we have this palatal crown torque, which we didn't want at first. And the majority of the cases that I can think now, I don't want that. Why don't I want that? Because when we do this, in, for example, a class 3 patient with an anterior open bite, when you do this, we will throw the root of those anterior teeth against the cortical bone and the maxilla, for example. So they go with the crown backwards and the root forward. So the root goes forward and it goes against the thick palatal plate of the maxilla, which can generate root resorption, which can generate fenestration in this part of the buccal plate. So we probably don't want that to happen in the majority of our cases. Of course, we don't want that to happen. So take care of that, my friends. When you do this, you have to keep in mind that you have to do some kind of regulations here in order to avoid this situation, throwing the root against the palatal, the thick buccal bone of the maxilla. Same thing in the mandible, of course, but we are doing the example of the maxilla here. So this is what's going to happen, and if you want to avoid that, you have to prepare yourself to do torque. We'll deal about this later in our course. We'll talk a lot about torque. We'll speak it thoroughly because it's very important, this relationship between the rectangular arch wire and the position of the bracket. A rectangular arch wire and the inclination of the slot of the bracket. So this is something that we'll have a lot to talk about later in our course. So for now, you have to keep in mind that when you change the position, vertically speaking, when you change the position of your bracket, you're going to change the relationship between the bracket, the slot of the bracket, and the rectangular arch wire. Because what was thought for that specific tooth was a specific inclination that it's going to be read, it's going to be applied when you put the bracket in the center of the crown. In the center of the crown, in a vertical aspect. In the center of the crown is where you will have the right reading of the inclination of that bracket, that specific bracket, okay? So, is that important just in anterior teeth? It's the opposite. It's much more important in posterior teeth. Why? Because they have a huge inclination of their crown, especially the lower second and first molars. They have a huge inclination, lingual inclination of those crowns, and when we choose to do this kind of variation of the height, when we do the positioning of the tube, we can change a lot of the inclination of that teeth. Let's give you this example. The name here we have here, this expression, relative torques, are the reading of the inclination of those teeth, those tubes, those brackets and tubes, when you insert, for example, a rectangular wire with a certain inclination, which could be 0, could be a positive inclination or a negative inclination. We'll deal with this later, but now, just for explaining, just for understanding's sake, we're going to explain for you what is going to happen when you change the height in posterior teeth, which is very common. If you think about it, it's very common because sometimes you want to escape from the bite when you have a deep bite, trying to escape of the contact between the crown of the upper teeth and the tube, sometimes we do that without thinking. We flee from that position, we escape from that position, going down with the position of our tubes. So sometimes you do that. Sometimes we want to do that in order to not be necessary to put, for example, bite ramps. Just go downwards a little bit and we think it's okay. It's not okay. In the majority of the cases, we have two problems with that. First of all, you will not have the crown leveling of the crowns of the ridges of those crowns, because you have different position. So the first thing. The second thing, which many people don't think about, is the torque, is the inclination. So that's why here is written relative torques. Let's understand a little bit more about this. When you put, for example, a perfect positioning of posterior teeth, let's say a second molar. So you put the band here, you put the tube here, and at the center of the bracket, at the center of the tooth, I'm sorry. So you positioned correctly, and now you have a neutral torque, meaning you don't have an actual torque in your rectangular wire because you didn't do this torque. You just bought those wires and they come neutral, and you put this wire here inside this tube. What is going to happen? Nothing. You will have a relative passive torque, meaning you won't have a couple generated here which would change the inclination of this tooth, this specific tooth. So in this case, the crown is well positioned, is perfectly positioned, and the bracket and the tube here was perfectly positioned during bonding, okay? So now, putting this wire here, a full-size wire, nothing happens because we have here a passive relative torque, meaning nothing will change concerning the inclination of this tooth. But what will happen when we change the inclination, when change the position, for example, upwards of the position of this tube? When we go upwards, when we go in an occlusal direction with this tube here, as you can see, let me move it again. As you can see here, we have now a different relationship between the inclination of this tube and the inclination of this wire. So now, when you insert the wire inside the tube, you will generate now a couple, you will generate now an active relationship between the wire, which is neutral, no torque, and the inclination of the tube, which you moved, and since you moved, you changed the relationship, the inclination of the slot. So now you have a torque, an active torque, which we call a lingual or a buccal crown torque, or a lingual root torque, okay? And when you do the opposite, when you do in the opposite direction, when you go downwards, when you go apically with this positioning of this tube, what is going to happen? Quite the opposite. It's going to happen quite the opposite. It's going to happen a torque, a negative crown torque, meaning the crown goes lingual, the crown goes negative, and the root goes buccally. So when you change the position, when you go to the rectangular wires running our sequence of arch wires, we reach the rectangular arch wire, especially the stainless steel rectangular arch wire, we will change the inclination that those teeth or this tooth is going to read, because we changed the height of the positioning of the bracket or the tube, okay? So for now, we're going to stop, and you're going to process all this information, and you're going to say, okay, now I have to pay much more attention during the positioning of our tubes and our brackets. So we go on with our understanding of what to do before doing bands and loops, because it's important for you in your day-to-day practice. See you later.